Hi, my name is Maria, and I'm here with Dr. Jawaher. Very excited to interview her because she knows a lot about this conference and conference that has been very exciting for most people that I've been interviewing. This is the 11th Abu Dhabi International Conference for Dermatology and Aesthetics. Doctor, how are you?
I'm fine. Thank you so much, Maria, and thanks for the nice introduction.
Thank you. Marhaba, Doctor. Obviously, what a pleasure, what an honor. Thank you so much. But you know this conference more than anyone, and you've been participating along the years. Tell me what is about this year that you are very excited about.
Actually, it's growing and becomes more in a higher level every year. And now it is the 11th edition. And we are attending this conference every year. And we see how it is progressing, having or inviting experts locally and even international experts. That's why we have the very good exchange with the knowledge, with the experience between us and other experts from other countries. So this is very important about this conference. And it actually, if you look and go through the scientific programs, it's really, the content is very rich. And you can see most of the skin conditions that we see on daily basis in our clinics. And it helps a lot the dermatologists when they are managing their patients and when they are looking for the updates for the management and treatment for different skin diseases. So that's what you are looking for as dermatologists, for the new things, the updates in medications, treatments, even if it is something very specific in pathophysiology in certain diseases. So
Yeah.
this is very interesting.
Very interested. And like you say, I mean, for what I've seen and what I read, they just bring the most updated topics into the field, right?
Yeah.
So this is very exciting. Is there any particular topic that you're interested in this year in the conference?
Actually, no, because we are in era about biologics and even JAK inhibitors and the new medications for different autoimmune diseases. So they focus also on vitiligo, alopecia. Will not forget even about the psoriasis, atopic dermatitis, urticaria. All these diseases actually have impact on the quality of life of the patients. That's why it's very important. Every year we should take care of such diseases and highlight on such conditions to know more about them, to know, as I say, the updates in managing such diseases to help our patients to improve their quality of life. That's what we see actually with our patients in the clinic.
Yeah, okay, perfect. Doctor, who do you think or who would you recommend to tell or who would you tell people they need to come to AIDA? Like dermatologists, we know dermatologists, aesthetics need to come here. Who else should come to the AIDA conference every year?
If you will talk about dermatology in general, even if you start with the junior, you start with the medical students. We need to invite the medical students to come and be familiar with the dermatology field, with the dermatologists themselves. And even we give chance for the nurses who are working in different specialty clinics. So if they are specialized or working in dermatology clinic, it's better to have expert nurses, for example, in treating psoriasis, the diseases that we have just talked about. Yeah, so it's very important to have like a cooperation between doctors and nurses, to have students, to have residents, to be familiar with the field of dermatology. It's a huge. It's not like a small thing to know about it. So it's good to have all this group of people.
That's a very interesting point, doctor. I didn't think of it, but it's true, Lord. Like you guys have the doctor, the dermatologist, but also there's the nurses and everything assisting you. And for them to be updated in all of this is extremely important.
And even if you think about the aesthetic part, you need to even to invite the technicians regarding the laser. It's not only doctors. So others may have also good experience and even share their experiences in using different machines in their clinic and centers.
Yeah, perfect. Okay. Now let's talk more about you because obviously you have the knowledge that every single woman wants. Thank you so much. Now, tell me in your practice, what would be something that you would recommend to I'm not gonna take the men out of this one. I think every single human being should take care of their skin. What would be a recommendation that you give in general to people so they take better care of the skin?
I see. So it's very important to know the type of the skin they have. So if they know exactly the type of the skin, at least to have one consultation with good dermatologist to know the type of the skin. So because you're going to go to pharmacy, for example, or going even to any beauty shops to buy some makeups products, for example. So if you know exactly the type of the skin, if you have sensitive skin, dry skin, normal skin, combination, oily skin, so you will choose the right product for your skin. That will help it to make it looks very fresh, healthy. It's not like something you feel that you are looks tired. So it's good to have the right product for the right skin.
Okay, so that's a great advice. Dermatologists are not just for diseases, they can actually help you identify the skin type so that everything that you do will work better. Perfect. And what is that you love most about your job?
Oh yes. Actually, I love my patients, because if you build a good communication between you and the patients, you will success because you will absolutely sure that the patient will come back. You will make sure that the compliance in using the treatments will be excellent. So the communication is very important as a part of my job when I talking to my patients, starting building this kind of relation with our patients. The education during this part in communicating the patient, educating the patient will help a lot that the patient will understand well the nature of the disease and even will understand well why he take this kind of medication, how he will use the medication. So you make sure that he will come with good results, good improvement according to what you said and how you communicate with your patient. So that's why I usually advise even my colleagues, don't forget the communication, the education part in managing your patients.
Yeah, very important. Very, very important. Perfect, doctor. And is there any specific skin condition that you feel you're very good at treating? Meaning, I don't know, psoriasis or pigmentation. If there's one that, like, I know I can help this person every time they walk to the door.
I see. Actually, there are many, but now we are working much on those bit challenging, difficult to treat diseases like hidradenitis suppurativa. One of the challenging disease that really has negative impact on the quality of life of the patients and their job and their daily activities, even disturbing their sleeping. They don't have social life. If you understand well how this disease is progressing, how it is so bad, and even how the lesions and the complications of such disease, how it looks, you will feel really sorry about such patients.
Is this a genetic disease?
Yeah, the genetic and one of the autoimmune diseases.
One of them.
Yeah, actually, briefly, I can say it's recurrence of abscess and nodules, painful skin lesions in different part of the bodies, especially the axilla, under the breast, in the groin area, gluteal area. So just imagine if one has recurrent abscess and nodules, painful lesions on a gluteal area, how they will sit, how will they sleep, how they will go to work. And this kind of lesions associated with pus, with blood, with pain, burning sensation, they don't feel comfortable in the whole day. So such patients really need help from the doctors, from the country, from the government to have good life.
Yeah. What will be the early signs of this condition? So people, once they hear this and like, oh my gosh, the doctor spoke about it, I need to go see a dermatologist.
Exactly. We are talking about the type of the lesions. We call them abscess or nodules. It's like a pimple skin lesions. And not only the type of the lesion, even the sites, the location where we can see in the, as I mentioned, in the axilla, on the breast, in the groin area, gluteal area, inner thighs. And some people in severe form, they may have it also on the face, on the scalp.
Okay.
So when they just have kind of such lesions and it recurs every month, or we can say if it is more than 6 times and during the 6 months, so they have to consult a dermatologist and start having the treatment in a proper way.
Okay, that's very important because I think sometimes the skin, it heals. So people kind of like, oh, it was nothing and they forget about it. But if they haven't in a recurrent way in a period of 6 months, definitely they need to see a dermatologist. Okay, and what is the treatment for this condition?
It depends on the severity of the disease. So, because there is some mild form, moderate, or severe form. The mild form, we can treat it with topical medications like topical antibiotic. For a bit more severe, we can give systemic antibiotic. It's not for short periods. We may have it 3 to 6 months. Even biological medications now approved for such medications help to reduce the risk of having a new lesions. Not only this, usually with this kind of disease, we need to have good collaboration as a multidisciplinary team with other specialties. So we work together with the psychiatrist in case the disease affects the life of the patient. Maybe they may develop anxiety, depression. So we need to consult or refer the patient to the psychiatry. And even the surgeons, we need their help because they work much at this part, especially the moderate or moderate to severe form. They need to do some simple surgeries or even big use surgeries for such patients.
Okay, perfect. Okay, so you heard the doctor. First of all, visit a dermatologist just to even to get to know your skin type. I think this is very interesting and very interesting. And second of all, don't ignore the early signs that, it may come to something more severe. What a pleasure. And thank you so much for being here. Thank you so much for participating in AIDA conference. What a beautiful place to be. Amazing. Yeah.
Amazing, prestigious conference.
Yeah.
So much.
Thank you. Thank you, doctor. Thanks.